Coronavirus coverage now. With more than 9 million confirmed cases, the nation has now broken a global daily new case record. The U.S. reported nearly 100,000 new cases in a single day. Meanwhile, in the Bay Area, a testing event at an Oakland church highlighted the importance of discovering people who are not infected. KPIX5's John Ramos explains.
The church has held community testing events in the past, but they have changed over time, and they're a reminder that there is still much we have to learn about how this disease works. Today's testing at Oakland's Acts Full Gospel Church looked different from the one held in June. Back then, cars filled the parking lot and were backed up into the street. Today, it was quieter, less urgent. But Dr. Kim Rhodes says testing at a pop-up site like the church can yield valuable information for those studying the disease.
We're testing first-time testers, so we're capturing people that are not in their data sets.
And that's because they trust coming to a place like this.
And that's what we believe.
She says as they test more members of the African American community, a mysterious trend is emerging. The black community has a much lower rate of infection.
We've tested close to 900 people at this point, and we've had 5 positives. 5.
The problem is, for black people who do contract the disease, the death rate is much higher than usual. Dr. Rhodes says that may be physiological or the result of inferior health care options. She's not sure. It hasn't been studied. But Brondon Reams, a pastor at another Oakland church, stopped by for a COVID antibody test and says, by and large, black people are taking the threat seriously.
Sure, there's a population of young people and different ones who are not, but the majority of us are trying to listen to the science, trying to follow the rules, and do what we need to do.
Right now, the questions all revolve around who is getting the disease, but that may be missing the point. Why do African American people have a lower infection rate? Are they doing something right that we're not doing?
I'm so glad you said that, because as we've been through, a number of tests, a number of different test locations around the city and seeing the same thing over and over again, I'm starting to wonder, should we be asking the question, what is it that is going right in the African American community with regard to this pandemic?
It may turn out that success in fighting the disease will depend on studying those who are not getting it as much as those who are. In Oakland, John Ramos, KPIX 5.